Good afternoon, ladies and gentlemen. This is Dr. Famuyiwa, your host of Fertile Talks, with another episode. So, quick question. Do you know, for my gentlemen out there, that your sperm can be affected by high blood pressure and even pre-high blood pressure? So, in today's episode, we're going to take a deep dive into a very important topic, a very overlooked topic, and that's the relationship between high blood pressure in men, male fertility, and assisted reproductive technology. And for this episode, I'm also going to review a couple of recent articles that explores this relationship at a deeper depth, should I say, and even exploring its early stages and what it can do to semen quality and to success. So if you're a male listener to our episode and you are thinking of fatherhood one day, or you're someone thinking of supporting your partner's fertility journey, then this episode is for you. So let's take a closer look at how high blood pressure, hypertension, as we call it, and pre-hypertension may be influencing reproductive health. I think the first thing we need to be aware about is probably close to over 1 billion people on planet Earth have high blood pressure. At least 32% of men have high blood pressure, and another 42% have pre-high blood pressure. What is the definition of high blood pressure? High blood pressure is defined as a blood pressure of greater than 140 over 90, and pre-high blood pressure is defined as a blood pressure of greater than 120 but less than 140 systolic, and a diastolic blood pressure of greater than 80 but less than 90. So in the first study that we're going to look at, we're going to be discussing, researchers discuss the impact of high blood pressure itself on sperm health. In a pilot study in human reproduction in 2012, they compared men with high blood pressure to those with normal blood pressure. And the results were actually startling. Hypertensive men had higher levels of a protein called clusterin in their sperm. Clustering is a marker for abnormal sperm morphology as well as DNA fragmentation. The study found out that hypertensive men had a significantly higher percentage of sperm showing structural damage and DNA fragmentation. So this suggests that high blood pressure could be playing a direct role in the deterioration of sperm quality, even when conventional semen analysis doesn't show abnormalities. So what's interesting is that the study has ruled out the potential effect of medications used to treat high blood pressure, indicating that hypertension itself is a key factor here. So the other study that I looked at involves pre-hypertension. So we've gone from hypertension. We know that hypertension is not good. It has some deleterious effects. And we know not a lot of people even know that they have hypertension. I think what's really curious for me is the fact that there was a recent study published this year, 2025, in the Journal of Andrology. This article focused on pre-hypertension, where blood pressure is elevated, but not necessarily in the hypertensive range. This study looked at how pre-hypertension in men affected sperm quality and outcomes for assisted reproductive technology. So specifically in couples undergoing their first frozen thawed embryo transfer cycle. What the researchers found was concerning. Men with prehypertension had lower sperm motility and sperm count. They had poorer sperm quality compared to men with normal blood pressure. So these issues led to significantly lower clinical pregnancies rate and lower live birth rates in the pre-hypertension. And this is surprising because I think we were expecting this in the hypertensive group, but no one looked at pre-hypertension. And this particular study was conducted out of China, where they looked at several data from millions of patients, and that's very surprising. So they even adjusted for things like uh, basal muddy, basal basal index, age, smoking habits, hypertension, that remained an independent risk factor for poor ART outcomes. So this study underscores the importance of monitoring blood pressure as part of preconception counseling, especially for men planning to use ART. So let's look at some of the underlying mechanism. Why is this so? So what's happening biologically that links hypertension to poor sperm health? Both studies have suggested hypertension could disrupt normal blood flow to the testes, affecting the cells that produce sperm. So these can lead to oxidative stress, DNA damage, and mitochondrial dysfunction, all of which impair sperm function and fertility. So in addition, high blood pressure may alter testicular morphology, testicular shape, and endocrine function. So this further contributes to decreased semen quality. The second study that I looked at studied specifically it highlights how these factors can translate into reduced success rate using assisted reproductive technology. So for men who are planning to conceive, it's important to be aware that the potential impact of hypertension and prehypertension on reproductive health. So these studies suggest that blood pressure monitoring should be part of the preconception screening. So if you're a man with high or even borderline high blood pressure, adopting a healthier lifestyle such as regular exercise, a balanced diet, and smoking cessation and blood pressure management could help improve sperm quality and boost ART outcomes. In some cases, antioxidant supplementation may help to protect the sperm from oxidative damage. However, more research is needed to determine the best interventions for men with high blood pressure or pre-high blood pressure. So basically, let's wrap up today's episode. This highlights how even moderately elevated blood pressure can affect fertility. Hypertension and prehypertension were found to be linked to poorer sperm quality and decreased success in assisted reproductive technology. So men planning to start a family, it's crucial to consider blood pressure as a factor in reproductive health, and it's a good idea to discuss it with a fertility specialist. So early intervention and lifestyle modification can go a long way in improving natural and assisted fertility outcomes. So, as always, I encourage you to stay informed and be proactive about your health. And for my gentlemen, please check your blood pressure. I know most men, they just don't check, they don't go to the doctors. I'm strong, I'm healthy. But really, you need to check your blood pressure before you start on this journey. So join us next time for more fertility insights. So I hope you've enjoyed today's episodes, and don't forget to like, subscribe, and share Fertile Talks. So follow us on social media for more updates. Sincerely yours, Dr. Famuyiwa.